Welcome to the Thumbprint Project Foundation's docuseries, Childhood Domestic Violence, The Hidden Public Crisis. I'm Drew Schlossberg of Cloudcast Media. We're thrilled to have in the studio with us today Dr. Lisa Conradi, clinical psychologist for the Chadwick Center for Children and Families at Rady Children's Hospital, joined by Dr. Chadha, a psychiatric physician. Thanks for coming in for this episode.
Thank you.
I appreciate it. We'll start with you, Lisa. Talk about your background. How long you been at Rady's and how did you get there?
Yeah, so I've been at Rady Children's Hospital since 2006. Right after I got my doctorate, I was very interested in dealing with domestic violence and issues regarding domestic violence. And I ended up doing my postdoc up at the University of California, San Francisco, working with children exposed to domestic violence. And so that was something that I became very passionate about. And then that is actually what brought me back to San Diego so that I was able to join the folks at the Chadwick Center. And I've been there at this point about 14, 15 years. And I'm currently the clinical director, and I oversee all of the clinical programming, forensic and medical programming at the Chadwick Center.
Thank you so much. Dr. Chadha, your background?
So I'm a general, prison, and forensic psychiatric physician. I have worked in this field for over 11 years. I started working in a state hospital, and I took care of women who were either incompetent to stand trial, criminally insane, or mentally disordered offenders. So working with women who often have children or who often themselves are survivors of abuse got me very interested in the area of childhood violence and what it is like to experience that. I also do a lot of forensic work where I serve as an expert witness in trials and write reports and testify. I briefly worked in a transitional age youth program, going out into Compton, Linwood, and Watts and seeing kids, more like adolescents, and helping treat them and their mental illness. And now I actually work in the correctional setting and take care of inmate patients.
Right. Now, in the jails, in the prisons, where? All over?
In the California prison system.
Okay, in the California prison system on this. So Christy Bruce Lane, the president and founder of the Thumbprint Project Foundation, had 90% of the prisoners, when prisoners, I should say, come from domestic violence,
Mm-hmm.
right? And it's that cycle that is so hard to break. Talk about that.
Yeah, I mean, I can't say that there's a single inmate patient that I treat that doesn't
Right.
have some trauma history, whether that's being abused themselves or growing up around gangs or having parents, who were abusive towards one another. So kind of seeing that violence normalizes violence, unfortunately,
Right.
and the cycle continues thereon.
Right. How do you break it?
I
mean,
think
that's a $150 million question, of course. If you can answer it, then I'll hand you $150 million.
So the earlier, the better. So
Yeah,
we
exactly.
found that in kids and adolescents, you can do something called empathy training and help break that cycle. Once I see inmates that are adults that are in their 30s, 40s, and 50s, people can change, but it is much, much harder. And I work to treat at least a brain disease component so that they themselves can elect to then do the work to help change the trajectory of their lives.
Right, exactly. And we know with COVID, 50,000 little tentacles that come with COVID.
Yeah.
And one of them is that the perpetrators of domestic violence, Lisa, are home with the families and so forth. And listen, now there's really no place to go because it's happening. Has it exasperated the situation?
Well, COVID adds a lot of stress to every part of our lives, right? So folks who are prone to depression start to feel more depressed because they're the things that we do to help ourselves feel better, whether it's socializing, whether it's going and exercising, those are all more difficult for us now. So same happens in families where there has been domestic violence or other kinds of trauma. The same stressors are then exacerbating so that we're more likely to see increased violence, increased abuse. And while we're seeing decreased child abuse reports for domestic violence and the other types of trauma, we think that's more because the people who see kids, so teachers, coaches, they don't have their eyes on kids. But one of the things we are seeing is a higher incidence of more critical medical problems, so head fractures in kids or other kinds of physical abuse or domestic violence that come in through the hospital. So we are seeing higher acuity, even though we're seeing less child abuse reports.
Right. So the police will come and drop off a kid that is experience this to Rady Children's Hospital. What happens next?
So we're the Chadwick Center is what we call a child advocacy center. Yeah. So that is a whole community-wide approach to addressing things like exposure to domestic violence. So the first thing we might do in that scenario is conduct a medical exam if there are injuries to the child. We might also do what we call as a forensic interview. So that's trained interviewers sitting down and talking with children about what they've experienced. So that's kind of the evidentiary component, so we can understand what the child has experienced, so that can be shared with our local multidisciplinary team. And then for us, the real kind of key to this work is the interventions. So we have a couple of different types of interventions that we use. We have a short-term intervention that's designed to really be educational in nature, to help the child and the family understand what they've experienced, what is kind of normal, the normal responses that might happen. And we actually find that can be incredibly helpful if you can get with that child early on. It can actually mitigate some of the negative impact that comes later. And then we have longer term interventions. So unfortunately, some of our kids have had lots of bad and scary things happen to them. So there's trauma-focused evidence-based practices, which are therapy services that are designed for kids who've experienced these things and we know work. So there's research to support that if they engage in these services, we see good outcomes later in life.
Yeah, that makes all the sense in the world. And Dr. Chadha, when you're dealing with the prisoners, of course, is there a pattern where we mentioned 90% of the prisoners have experienced domestic violence before, and probably their parents and their grandparents, and you go down the list and all that? Is there a way to pinpoint at a certain age that, unfortunately, this young kid is being exposed to domestic violence, and if we don't correct this person's going to be on a path to be incarcerated?
I think that's a great question. There is something called neuroplasticity. So our brain is able to evolve, adapt, and shift until a certain age. They say personality develops by your late teens, early 20s. And often we see mental illness around that age group as well. So if we can intervene around that age group or before, the earlier the better, obviously. The more a child is exposed to traumatic events, their brain structurally actually changes in response. Their adrenal system changes. Basically, their whole body is affected, not just their mind. Right. So the earlier the better, but usually after late teens and early 20s, the ship is starting to sail. Personality has been formed. The brain doesn't kind of adapt or reconnect itself as well as it used to. And that's where we get stuck with people.
Right. So what types of intervention strategies that you use or can use?
Well, the first thing is that I treat people's mental illness, the actual brain disease, because if they don't have that component, solid, they really can't do the rest of the work.
Right.
I've been lucky and blessed that for the last 11 years, I've always worked in a team. So I've had psychologists under me, nurses, rehab therapists, social workers. So everyone does their component, whether it's therapy, teaching the patient job skills, teaching the patient what effective family communication is, things like that. So we work as a whole team to kind of make sure that the ship sails in a better direction.
Right. And I know, I imagine you're laser beamed on science, and are there a lot of studies that are coming out of what you folks are doing at all?
Yeah. So there's actually even functional MRI studies and PET scans that show different areas of the brain light up, shows cortical atrophy or deficiency in certain areas. So, this idea that your brain is actually changed by experiences that you have is a very powerful concept. I mean, there are tons of studies coming out of Harvard even that talk about how yoga and meditation change your brain. So it's something that people are looking at. The more we can examine the brain now, the more we're finding out that our life changes us and our cells even.
Yeah, without question. Lisa, talk about negative neural pathways. What is that?
So when we think about negative neural pathways, they're really pathways that are developed from, so as we were talking about, kids' brains develop by experience. So the brain grows based on either the positive experiences that they have, or potentially the negative or the neglectful experiences that they might have when they're young. The more positive experiences a child has, the more positive neural pathways can develop. That helps kids learn, develop, connect, attach, develop relationships with other folks. But when we don't have those connections, then we see more of that kind of negative neural pathway where kids have to, in order to survive, all of the brain's attention goes towards being aware of what's going on in the house at all times versus the things we want kids to be able to focus on, which is growing and thriving.
Right. So when you see someone that's brought to you, it's been, had some domestic violence or childhood violence at your area, do you see it done as a family? So is it not just one of the kids in the family, it's all three of them? Or in some cases, is it just one kid?
So that's a really great question. So what we see among siblings who have all maybe been exposed to the same experience is that often they have different responses to that experience. And that sometimes we see some kids in the family might be kind of identified as the target child, whereas others might be more witnesses to what's happening. So, or one child might be more of a protector of the other kids or trying to protect the parent who's being abused. And so kids might live in the same house, but experience that house in very different ways, which can then translate into the types of services and interventions that would be most beneficial for them. But I say that any work that we do, we really like to have a family perspective so that these kids can understand the role that that everybody has played in this family and can move towards healing together.
We are chatting with Dr. Lisa Conradi. She's a clinical psychologist for the Chadwick Center for Children and Families at Rady Children's Hospital, joined by Dr. Chadha, a psychiatric physician working with incarcerated. They are incarcerated. They got to be prisoners in that aspect of it. Let me ask you this, Dr. Chadha, for those people that might be interested in getting into the field that you're into, obviously you got to be a special type of person to deal with what you're doing. What advice would you give?
I mean, I find it very rewarding. And if you want to do something where you feel like you can make a big impact, this is a great field. It's not for everyone. I have 13 plus years of training post high school. And then I learned a lot on the job. I was trained in forensics. So I was trained evaluating inmates and evaluating defendants for the courts. And I was trained in psychiatry. So I was trained at just treating brain diseases, but looking at, obviously the life story, personality, all the other factors that come with an individual, the behaviors they choose. But you never really get prepared for dealing with the emotional trauma someone goes through. And that's something you pick up on the job. So when I was in medical school, I volunteered at a domestic violence shelter, which is probably why I ended up treating women for 10 years who were likely victims of either domestic violence, child abuse, or both. That's something that you develop that tough skin, and you either can do it and have empathy, but then not take it home, or not. And it's not for everybody.
Yeah. Well, I mean, it's an important factor. I mean, it is what it is. Does our region have more issues of what you deal with than other regions in the country, or are we pretty much like a eighth largest city of the country would have?
Well, unfortunately, domestic violence does not know class, socioeconomic status, race, ethnicity. It's everywhere in the world. Things that affect domestic violence are literacy rates. So if women are educated and have resources, then usually they can avoid or get out. And if their family of origin also had that, that's beneficial. But beyond that, this is a universal disease.
Well, you're so spot on. We've been fortunate enough to be very much involved with the San Diego Council on Literacy. And 70-80% of those that are incarcerated are functionally illiterate. Okay, to your point on this stuff. So there's many ways you can get to some things before they get to this stage, without question on this. So Lisa, obviously the Thumbprint Project Foundation provides some just great services and all that. What would you do to encourage people to take a look at the foundation and support what they're doing and what you're doing?
Well, I think understanding that this happens in so many of the families and in the kids that we see every day, it's one of those kind of it's invisible to so many people, right? And so but what we know about exposure to domestic violence is it happens a lot. And that if there's violence, if there's other kinds of trauma, for many, it's 1 out of 4 kids. So this isn't just something that happens to those families over there. This is something that is happening in your neighborhood, that is affecting the kids that go to school with your kids, that is your friends, and you may not know about it. So it really, what I love about the name Thumbprints is it tells us about how it impacts so many different people in different ways. And so I think part of what I would do is encourage folks to understand that this isn't just something that happens over there. It's happening right in their neighborhood. And so it is important, and it's right in front of them.
And people need to speak up.
Yep.
Obvious statement of the year, of course, but it's amazing how that doesn't happen in a lot of ways. And, so what advice would you give, Dr. Chadha, to our audience out there of here's what you really need to keep an eye on. Here's what you can do to support foundations like the Thumbprint Project Foundation.
I think the biggest thing is to focus on resiliency. And I think the more that we try to develop that in ourselves and as we become parents, teach that to our kids, that would be really important. And to have compassion that, not everybody is in the same boat. And every single person, whether you're a survivor of violence or not, has some trauma and some things that have affected them badly. And being able to develop and teach resiliency and to be able to overcome and having the compassion to reach out to someone to help maybe model that or, write a check or do something for someone, to pick a career path that helps someone is super important.
No, that makes all the sense in the world. And you'd like to add
I was
to
just
that?
going to say, I love the model. Once we see that somebody that looks like us has overcome, then it opens the world up. So the more you can volunteer to be a mentor, the more that these kids and families can see that there's hope and there's a different way of living.
Right. Any final comments, Lisa?
Well, I just think that one of the things that our folks experience, and that this work is hard. It's hard work, but it is important, and how we get through it is understanding together. Things like this, working together to address it as a community response. So the more we can be aware, the more we can focus on strengths, and the more we can connect with one another is how we can actually overcome things like domestic violence.
Absolutely. Dr. Chadha, any final comments?
Yeah, I like that you said that it's hard, but being stuck and being in pain, and whether it's physical or psychological, is very hard too. People are terrified of pain. And so they just want to wall it off like an abscess. Sorry to use another medical example, but they want to wall it off and then ignore it. But the thing is, if you ignore these abscesses, eventually they could all burst and you could become septic and die. So it's to have that courage to face their pain, to realize you're not alone, that all of us have stuff, and to open to that and to start the healing process is so key. So it's hard to do this work, but it's really hard to stay stuck as well.
Without question. Well, Dr. Chadha, psychiatric physician, thank you so much for joining us. And of course, you, Dr. Lisa Conradi, the clinical psychologist and director of the Chadwick Center for Children and Families at Rady Children's Hospital. Can't thank you both enough for the important work that you are doing. Wishing you nothing but great success moving forward. And I'm sure we'll be chatting somewhere down the line.
Thank you so much.
You bet. I'm Drew Schlosberg of Cloudcast Media, and you've been listening to another edition of the Thumbprint Project Foundation's docuseries, Childhood Domestic Violence, The Hidden Public Crisis.